Hello, my name is Eve and I'm a master esthetician in Washington State working in a medical practice. I'm excited to give you a brief introduction to the effective plasma pen fibroblasting skin tightening treatment. Plasma pen fibroblast skin tightening is a non-surgical, non-invasive treatment that contracts and tightens the skin while stimulating new fibroblast cells that in turn produce more collagen. The result is smooth, firm, lifted, younger-looking skin after an 8 to 12 week time frame. Although most plasma pen treatment is virtually pain-free, your own treatment can be mildly uncomfortable and sensitive depending on the area being treated, especially if it's the upper eyelids where the skin is often thinnest. I always numb my patients prior to the procedure for about 30 minutes and use Saran wrap to help with the absorption, which seems to do the job each time. So how does the plasma pen treatment work? The plasma pen treatment uses plasma gas to stimulate fibroblast production, resulting in the contraction and tightening of skin cells. Sadly, the number and productivity of fibroblasts decline with age. Plasma fibroblasting treatment sublimates the tissue being treated, avoiding the spread of unwanted heat to the surrounding areas. The principle is to ionize the plasma gas in the air as to create a small electrical lightning bolt, forming a very small micro injury to the dermal and epidermal treated area. The result is to reduce the appearance of benign lesions or unwanted wrinkles. When the electrical arc plasma touches the skin surface, the heat widens and is subsequently transferred to the epidermis all the way to the papillary layer, which contains the fibroblast cells. Fibroblasts are active spindle or star-shaped cells in the dermis whose function is to increase the production of fibers, collagen, and glycosaminoglycans, essential for normal cell growth. Consequently, excess lax skin contracts and tightens with greater tone and lifts the skin with visible wrinkle reduction and can also remove select benign lesions. Skin remodeling occurs with healing as a result of controlled skin damage when done by a trained medical esthetician. When treatment is done correctly, there usually isn't any open wounds during the healing phase as there are with ablative lasers, reducing the risk of negative side effects such as infection or loss of pigment or hyperpigmentation. So please let me demonstrate plasma fibroblasting on the upper eyelid now. When you are starting fibroblasting, you don't actually touch the skin. We're forming tiny little crusts and going right above the skin, following on either side of the wrinkle. How are we doing, Mary?
I can feel that a little bit, but it's not too uncomfortable. Yeah.
So you have the little plasma lightning bolt arc, and we're going right above the skin on either side of the wrinkle. She's tolerating the procedure well, and we'll keep on going. If plasma pen skin tightening is something that you would like to consider for yourself, my strong recommendation is to see a master or medical esthetician who is experienced and set up a consult to see if you're a good candidate. Good luck, it's worth it.